All right, Rochelle, let me sit you up and discuss your findings. Just want to ask if you have any concerns for me at all right now. Any questions regarding treatment
Well, yeah, actually I do.
or your assessment?
My doctor referred me here because I recently found out I had diabetes. And so he referred me to see you because I have like a weird like taste in my mouth and I'm not so fresh smell. So.
Not so fresh
Yeah.
smell. Okay. Well, my findings show that you have what's called periodontitis. It's a progression from gingivitis. It kind of progresses, and now it's called periodontitis. And what that is you actually have bone loss occurring in your mouth. I found you had generalized pocketing between 6 and 7 millimeters, and the gum tissue is no longer pointed like it was and healthy. It kind of progressed. So let me just show you, I want to show you the progression of your mouth. Okay, when you first came to us, you started off with the normal, healthy gum tissue, which is nice and pink and pointed and it's firm. And then it progressed to gingivitis when you came in, you were pregnant, and you had pregnancy gingivitis due to hormonal changes. And what that did is kind of created false pocketing. Upon probing, you had a lot of bleeding, you had inflammation, so these nice pointed tissue is kind of inflamed and puffy and red and kind of boggy to touch. And now, I mean, you haven't been in to see us for approximately 10 years, and you have progressed to periodontitis. And what that is...
Can I get rid of it? You said when I had like the gingivitis that it goes away, so...
No, you cannot get rid of this, unfortunately, but it is maintainable. So with regular visits, and I recommend that you see a periodontist. They may recommend that you seek treatment every 3 to 4 months instead of every 6 months that is normal for a healthy person to maintain oral health.
Okay.
So I would recommend that. Periodontitis is kind of blunting of the tissue. You've lost attachment. You've actually lost all of this pointed gum tissue. It is now receded or kind of gone upward, and then you're seeing root surfaces. So.
Oh, is that what that yellow is?
Yes.
Oh, okay.
That the color change is actually where the root is.
Oh.
And the problem with exposed roots is that it puts you at a higher risk for developing cavities, as well as it actually creates a rough surface for plaque and bacteria to kind of multiply onto. So that's 2 things that we showed you there. And your bone levels have kind of decreased. So your tooth is not structurally as sound as it was when you had healthy tissue, or even gingivitis, because with gingivitis we could reverse that with brushing and flossing and regular visits. Okay, I also have some other photos for you. This may give you a better understanding of where you are right now. So I just want to show you your normal attachment. This is someone who is in good health. They have a little bit of bacteria, plaque that surrounds the tooth, but it's not much, and they usually remove that with brushing. So you'll see some of these orange circle areas are the bacteria attachment. And then if you let that go, you're not brushing, you're not flossing, more bacteria multiplies, and it kind of grows around, and it's irritating the lining of your gum tissue where that sulcus is, which is a space between your tooth. You have a microscopic space between the tooth and the gum tissue. That's where the floss reaches. So when you're not flossing, you get more bacteria and plaques to attach. So you want to remove that. If it's not removed, you get to a point where it's actually kind of multiplying even more, and it's traveling down through the gum tissue, and it's actually pulling the tissue away from the tooth. And you'll get that. And it's releasing endotoxins, and basically that is more dangerous than the actual plaque bacteria itself. It's more harmful, it does more damage, it grows at a much rapid pace, much faster pace. So that's going down, and as you see it, this little line around the roots of your tooth is called the periodontal ligament, and that holds the tooth in place. So once it starts to go down into here, it's actually essentially eating away that periodontal ligament. Once that has increased, it grows and it can actually decrease bone levels. It attacks bone, so that's how serious it is. You can actually lose teeth this way here. So this is something that you want to definitely take care of beforehand, but unfortunately you're already at this stage, so we want to maintain it. So we want to reduce this bacteria here to as minimal as possible.
Okay.
All right, so let's discuss your risk factors. So you said you were referred here for diabetes, and what a diabetic patient is concerned with is poor healing. So what you would normally have in a healthy patient, the ability to kind of fight off that bacterial infection that you have going on in your mouth. But because your immune system is kind of suppressed, your body's ability is kind of reduced. So you have to be more vigilant in your home care, as well as seeking regular medical and dental checkups. Also, I know that you're a smoker, so
only on the weekends. Like I only smoke when I drink.
Only, okay. That still is a risk factor for developing periodontal disease by 7 times, and that as well suppresses your immune system. So you kind of have both factors involved, the smoking suppressing the immune system as well as the diabetes. And your body's response, what we call a host response, naturally will also depend on how the periodontal disease, how the bacteria progresses. Okay. So if your body's suppressed with the diabetes and the smoking, or normally suppressed, that stress can do it as well. So even if your diabetes is controlled and you're on medication for it and you've quit your smoking, there's other factors in your own your body's ability to fight the bacteria. So and stress is one of those. Also, I noticed that you had some overhanging restorations, and which is due to when the dentist packs the filling in, the contour of the tooth is changed, so it's no longer the same anatomy of the tooth that you had. It's not anything that you've invoked.
Oh, so that's not?
No.
Okay.
It's something that should be fixed by the dentist that filled the tooth.
Okay.
But that kind of creates a pocket for the bacteria, food impaction as well. And I noticed when I probed into that area, you had an 8mm pocket. So it's definitely taking its effect in your mouth already. So you'd want to get that taken care of as soon as possible. So our goal is to try and reduce your risk factors, reduce your body's response to stress and diabetes and smoking. So by quitting smoking and being controlled and seeking regular medical visits, this will help, as well as dental visits. So, okay, we're going to go over current brushing and flossing habits. Okay. All right, I just want you to grab hold of this.
I really don't like brushing because it hurts.
It hurts?
Yeah, it bleeds.
Okay, and that's normal for where you are now. It's going to be uncomfortable because you have essentially a bacterial infection in your mouth, but you have to take care of it. So, I mean, we're going to take care of removing, you need a deep scaling, so we're going to remove plaque and calculus as best we can. So, but it'll start to heal up, the tissue will start to heal, and it will feel better for you, but you have to still brush and floss. Okay, show me how you're current brushing. Okay, so that's missing quite a few areas of your mouth, so I want you to kind of come up with a routine so that you're kind of do the same thing every time you brush. If it's easier for a lot of right-handed people, sometimes I know myself, I start on the left and move over to the right. So if it's easier for you to start on the right and make your way to the left or on the bottom, but kind of keep up with the same routine. Okay. And what you're going to want to do is put the brush, this is called the Bass method of brushing, at about a 45-degree angle towards your gum tissue, and you're going to actually feel it go underneath just a little bit. And it's going to take care of 2 teeth at a time. So you're going to jiggle the brush, and you can kind of do the sweeping.
How long does that take?
It's going to take 2 minutes
A
total.
long time.
I know, it's a long time to brush, but you got to get in the habit. And once you keep doing it over a period of time, 2 minutes is not going to seem so long anymore.
Okay.
So the problem is, because of the pocketing, you're not going to get, in a healthy patient, this 1 millimeter may be enough to really reduce all that plaque and bacteria under the gum line. For you, in your case, it's not going to really get underneath there like you need to. So it is reducing the amount on the crowns and a little bit under the gum line, but you're not going to get what you really need to get off. So that's why you may have to come in every 4 months, depending on what the periodontist recommends you do, just to kind of keep you more at a healthier level, maintain what you have, and not progress to more bone loss. Okay?
So what do you think about like those power brushes?
I actually recommend the power brushes. Studies have shown that they actually work really well, and especially for patients that have a difficult time angling the brush this way. They have a nice job. They remove plaque very well. The manual brush works just as well, but for some people, the power brush works better for them. You kind of do it in the same manner. You're not going to scrub with this. It's going to rotate for you.
So I've still got to do it for 2 minutes?
You still have to do it for 2 minutes.
Okay.
So,
it's a long time.
yes.
All right.
I also have what's called a proxy brush, and this gets in those areas. You know, you have the spaces in between your teeth. They're called embrasures, and they'll actually get in those areas very well for you.
Okay.
And it'll remove plaque and food. And we also have what's called super floss. So this is for areas that are kind of in between, not as open for the proxy brush, but a little bit more open than certain areas in your mouth, where regular floss, where this area would work a little bit better for you because you have a little tighter contact there.
Oh, so I can just use this one piece. I don't have to use
Yes,
regular
you can
floss.
use this one piece. This area is thinner, so for areas that maybe it's easier for you to get into with this thinner floss is good. And then you have this thicker area. It's kind of fuzzier. You're going to use that part for areas that are a little bit more open and you feel like you're getting the food trapped in there. So I'm going to have you're going to do this with the floss. Middle finger, wrap it around, and you're going to wrap it around your index finger, your pointer finger there, and you're going to grip it. And it's going to be a tight, close grip because you have more control over it when the grip is closer. And I'm going to have you hold the mirror up so you can see. And you're going to seesaw it in and wrap it around like a C, and you have to get both ends. So you're going to do that. I'm going to have you demonstrate for me. You can demonstrate actually the back of your mouth, where your molars are. That would be better because that way I know you can actually reach those areas.
Like this?
Yes.
That must be where that overhang is.
You can feel it?
Uh-huh.
So you're going to have to do as best you can to get in there because that is where your overhang is.
Okay. Will it stop bleeding soon though?
It should stop bleeding.
Okay.
Yes. The more work you do to increase your health, it's brushing at least 2 times a day, flossing once a day, and I also recommend Listerine. It is ADA approved for reducing bacteria levels in your mouth, and it works really, really well. So we're going to start off with this, and I recommend you using this 2 times a day, maybe in the morning and then at night.
Okay.
To reduce that bacteria level. And we can also use something called chlorhexidine, which is by prescription. It's something we usually do in office, and we kind of irrigate below the gum tissue with that, which also works really, really well for reducing bacteria. But we're going to start off with Listerine and see how that's going along with your brushing and flossing. So, and use the super floss as well as the proxy brush daily as well. Both of those items need to be used. Colgate Total is really well. It contains an ingredient called triclosan that works for up to 12 hours.
Isn't that like in hand soap or something? Triclosan.
Triclosan?
I heard that before. yeah.
I don't believe this is in hand soap.
Oh.
It reduces bacteria up to 12 hours, so even more than your brushing and flossing can do.
Okay.
And you really need this, so I recommend this. This is also ADA approved.
Oh, so after I brush, it still is working on my teeth?
Yes, it still is
Oh,
working.
Pretty cool stuff.
Yes, very good. You have any other questions for me?
No, you really helped me out a lot today.
Okay, good. I just want you to take this home and read through it. It's just a pamphlet on periodontal disease. So, and once I see you back, if you have any questions regarding your findings in there, the reading, so you can let me know. But it's just a good informational.
Thank you.